Good evening and welcome. Sorry for the inconvenience. Actually, the host has ended up the meeting before. That's the thing happened here. I think we'll wait for some more participants to join.
You can introduce first. You can introduce.
Okay.
By the time people will join.
Okay. Good evening and welcome everyone. Today is our 2067th day of continuous webinar. For last 2066 days, we are continuing this webinar in 3 languages, Hindi, Malayalam and English. Today's our guest is Dr. VANI OZA. She is MD in Homeopathy and PhD scholar. She is a professor and PG coordinator, Department of Veterinary Medicine in Rajkot Homeopathic Medical College, Parul University, Gujarat. She has 15 years of clinical experience and 8 years of teaching experience. She is coordinator of postgraduate academic program and consultant homeopath in Riva Homeopathic Clinic, and she is doing research papers. She published 2 research paper, and she is integrating her clinical practice with teaching. We are so glad to get you as our speaker of today. Thank you so much, and you are welcome, Dr. Vani. Thank you. You can start. Participants will join now because they don't know what happened. Already they were in the meeting, and the meeting ended up, no, so it happened. Okay, you can start, please.
So, good evening, everyone. This is Dr. VANI OZA. So, first we will going through that what is the allergic rhinitis, how it has happened, and what is the homeopathic concept or the outcome regarding the allergic rhinitis. And secondly, what is the miasmations, what are the basic remedies or therapeutic aspect, and how can we deal the cases which is affecting with the allergic rhinitis or patient with the allergic rhinitis. So first, what is the allergic rhinitis? That the allergic rhinitis commonly means there is rhinorrhea, discharge from the nose, and it is due to the allergic origin. So here the person is atopic or allergic to the certain substance from which the normal individuals are not affected by that. When they are exposed to dust, pollens or molds or any kind of allergens, the normal individual is not having that kind of hypersensitivity response what the allergic person is having in their life. So the allergic rhinitis is basically the swelling inside the nose, and it is often caused with dust, allergic thing or atopic things like dust, pollen and molds. So that is the basic definition of allergic rhinitis, that the person, the nasal mucosa is particularly sensitive to this substance, this allergens from which the another or healthy individuals are not affected by that. So it is allergy means the body's reaction that is too strong to certain things, which is the harmful in the normal individual, and from which the patient who is hypersensitive to that substance having the certain kind of reaction, allergic reaction or hypersensitivity reaction, what we are called in our medical terminology. So that thing, the person is sensitive or patient is sensitive to certain things, and their nasal mucosa is going to react with that thing. So rhinitis can be happen to many times in the life, but when it is recurrent, then it will going to cause it will be that the patient will going for the medical treatment for that. That usually we are having rhinitis in like there may be seasonal changes and we are affecting with the rhinitis, but the patient with the allergic rhinitis is continually having that problem that whenever he or she will expose to dust, there will be problem, and rhinorrhea, which is coming back and back. So if it is persistent, it is need a medical intervention in that condition. So that is the allergic rhinitis. Then what is the pathogenesis? How the allergic response?
Dr. Vani,
Yes,
are you moving the slides?
yes.
But I'm seeing only the first slide.
Okay. So what is happening? What is basic pathophysiology over here? That you can see that there is the allergic response, which is the sensitive individual or atopic individual. They will going to produce IgE. That is IgE production, and IgE will going to bind with the mast cell receptor, and there will be when there will be a re-exposure, there is production or there is discharge of histamine from this mast cell, and it will going to create the symptom in the person like this. This is the pathogenesis. Okay, so here there it will going to be bind with the mast cell, and there will be discharge of chemicals like histamine, which is and other cytokines, and it will going to create the symptom over here. Then why it is occurring? What is the genetic factors for the allergic rhinitis? There is MHC gene on chromosome number 6, which is responsible for generating the allergic rhinitis or allergic response in the individual. Then what can be the allergen? Look, allergic rhinitis, there will be basically two types. One is seasonal, that is called perianna, which is coming annually in the particular season. And second is due to the particular allergens, where the patient is going to have an allergy from exposure to dust or pollen or animal dendrine. So it will the person is having the allergic rhinitis many a times in the year, and in perianna the patient or the person is having only symptom during annually, like they are having the allergic rhinitis or allergic reaction in the winter, in the summer, or in the rainy season. So in the materia medica also we are having that kind of medicine, but usually in my clinical practice, patient is aggravated in certain kind of period or certain time or certain season, but they are also having the allergy or having they are having allergy to the multiple factor, not from the single allergen usually. That when they are exposed to dust, any kind of dust or the spray, all will going to cause the allergic response to them, and even they will going to aggravate, or the allergic reaction will going to aggravate in particular season. Okay, so here are the allergens, which is most frequently you will going to see in the patients, like grass and tree pollen, dust mite, animal dendrine, cat saliva, and moles. These are the basic allergens. And in our India, we will go basically having the dust. That patient will going to say that whenever we will going to expose to dust or any kind of strong smelling substance or vapor, right? From that, they are having the allergy basically. Then what will be the symptom? The common symptom is, as we know, there is the running nose. Patient will going to come to you with the running nose. Then there might be itching in the eyes, itching in the nose. There might be a stuffy nose, nose block. Then there might be coughing, or sometimes it will going to affect the bronchial tube. The patient is also having the wheezing over there. Okay, so that is allergic bronchitis has been started. Then many a patient is having sore throat with that. or certain patient is going to start with the sore throat and there will be a profuse discharge from the nose. Then there will be frequent sneezing, continuous sneezing patient is having after the exposure to the certain substance or vapors or any kind of allergen. Then there can be a headache with the nasal symptom and eye symptom. And in certain patients, you will also going to see that they are also having the sinus problem. So there is pressure over the nose, or there might be a severe headache over there. So that is the basic symptom which we will going to find in the allergic rhinitis. So these are the symptoms: itchy eyes, watery eyes, sneezing, runny nose, stuffy nose, itching in the throat, occasionally coughing they are having or experienced. Skin, usually we will going to find that it is usually affected. Allergic rhinitis is many a times they are affected with the skin problem or having the atopic or allergic patient, that they are developing certain kind of eczema or they having association with the urticaria with the allergic rhinitis. And in general, we are having headache over there. Then what are the basic epidemiology? Look, this is many of peoples are affected with the allergic rhinitis. In worldwide, 400 million peoples are affected with the allergic rhinitis, and it is 6 most common diseases. You will going to find more in the developed country. It might be due to the pollution and or there might be more pollination. So in epidemiology, you will going to find more in the Western country and more in the developed country. Then what are the diagnostic tests? How you will going to see that or confirm that the patient is having allergy to the substance or allergic rhinitis? First, in the blood cell count, we will going to see that there is eosinophilia, which you will going to see in any kind of allergies, like in the urticaria, right? So there will be a high eosinophil count. Then second, skin allergy test, which is usually positive to the substance from which the patient is going to be positive or the patient is allergic. And then one test, RAST, radio allergic absorbent test. RAST is indicated where the skin test is not possible, like the patient is having a severe kind of eczema. In that particular patients, the skin allergic test cannot be possible. So in that person or in that patient, you are having RAS. So these are the diagnostic test. Usually you will going to find that patient is going to be allergic to the multiple factors or multiple substance over here. So what is the homeopathic perspective for the allergic rhinitis? One, there is the hypersensitivity in the patient, that the patient is having morbid susceptibility. And obviously, there is the reactions of the miasm, whichever the miasm is predominant, the patient is having the symptom to that particular miasm. You will going to find that in the mental level, as well as you will going to see in the physical level in the form of rhinitis, characteristic of the rhinitis, characteristic of the aggravation over there. So it is basically an abnormal response. Here the vital force is abnormally reacted to the particular allergens, where the normal individual or healthy individual is not going to be respond. So there is morbid susceptibility to the particular substance, hypersensitivity. And obviously miasm will going to play the role over here. Then there is also obviously the psychological factors for genesis of this kind of allergic reactions. What can be that factors? First, there is psycho-emotional shock, or there is kind of destabilization which the patient cannot control, and his body will going to react to that certain kind of conditions there where the patient cannot control his emotions, or he or she will going to feel the shock in that particular kind of situation, and it will going to generate that feeling of surprise or any destabilization of emotions and any unpleasant feeling, which will going to generate that or the patient will going to become hypersensitive to that particular substances. So that is the basic you will going to see, or the response will going to see on the mental plane. So whenever you will going to take a case, you will going to find that patient is susceptible or sensitive to certain incidences, or he might having a certain problem or conflict in the mental level. So you will going to find that emotional shock or any kind of mental trauma or any kind of hyper reactivities on the mental plane. And in the silent phase, the mind will going to memorize that particular substance or particular situations. And in the noisy phase, the body will going to respond. So that is the silent phase is first phase, where your mast cell is going to be sensitized to the response, to the emotional response. And in the noisy phase, where the second time it or the in the future, when the mast cell is responding to the allergens, that is the noisy phase, where you are having the reactions of your body, of your immune response. So that is the psychosomatic aspect, basic aspect, that in homeopathy, what will going to be triggered? That the first thing will going to play the role, that is the emotional shock. Then there is the chronic stressors or prolonged stressors. And due to this, you will going to have an hyperimmunity over that. There is activation of immune response and inflammatory response, and it will going to there will be reaction or having the symptoms of allergic rhinitis like sneezing, congestion, itching over here. So that is the basic thing over here. That there is any kind of surprises, emotional shock will going to create this thing. So basically, there is a two stage. First stage is sudden emotion or stroke or stressful events that will going to play a role, and that is the beyond the limit of the person. He will not going to cope with that particular situation. And in second phase, where the symptom will going to arise. So there is a silent phase where he is affected or traumatized mentally or emotionally over here. And in the second phase, you will going to find that particular reactions. So what can be a conflict? There may be separation, heartbreaking event, which will going to take place over there. And the person is particularly sensitized at that time from which substance he was exposed to or he was taking to in that particular situation. So he is having that particular reaction to the particular substance, like certain kind of fumes where he is having the traumatization. So at that time, he is exposed to that fumes or that kind of odors or that kind of flowers or that particular season. It will be memorized in the mind of the person, and it will going to generate that particular trauma and particular response to that particular substance. So what are the miasms and what are the symptoms of that particular miasm? And what you will going to find in the local level. So basically we are having SORA, psychosis, syphilis, and also we are having pseudoSORA or tubercular miasm over here. So what is the role of the miasm in the homeopathy, and what kind of symptom you will going to see in that particular miasm? First, in SORA, you are having hypersensitivity reaction or response, where there is itching, burning, and watery discharges. That environmental triggers you can see. and there is emotional level is high than the normal person. In psychosis, you are having overgrowth, you are having congestions, you are having obstructions more in the psychosis miasm, and there is also a blockage in the nasal mucosa, and there is persistent symptom which is continually occurring. In the tubercular miasm, first you are having sensitivity, weakness, exhaustions, and there is tendency for restlessness, and you will going to find that patient is often affecting with the cough, and the chest is more sensitive, and person is fragile. In syphilitic, you will going to find that destruction, ulceration in nasal mucous membrane, even throat is going to be ulcerated, and there is also a tendency of degeneration over there, and it will also going to create distractions. So in the sora, there is chest, which is you are having dry, tearful, spasmodic, and irritating cough with this. Then in the psychosis, symptom may be improved with drainage or release. Where the discharge is going to be released, the psychotic patient is going to improve. In tubercular miasm, there is worse with the exertion. If the patient is going to exert shortly, the person will going to, or the symptom is going to be worse. There is in the syphilitic miasm, you will going to find that the symptom may be worse over time, and there is deeper damage over here. So in the sora, you will going to find that there is a kind of external stimulus, and the patient is intellectually keen and evoke slightest exaggerated response than the normal individual. There is soric manifestation. You will going to find that sneezing, redness, heat, sensitivity to touch, and discharge. The type of discharge here is thin, watery, acrid, and is sensitive to smell. When the air possesses freely with burning, and complaint are more during the morning hour, cold during the sleep, and relieved during the warm weather. And it is ameliorated by natural discharges. There is itching and burning in eyes also. Sora gives only physiological changes. There is no any kind of structural changes. And you will going to find that spasmodic cough over here. Next is psychotic miasm. In psychosis, usually you will going to have a family history of asthma, and there is nose may seem to be clear for short time, but later it becomes blocked. Usually you are having blocking of the nose over here, and there is enlargement of turbinate, and you will going to find that polyps over here, and there is swelling and enlarged small blood vessels over here. And children usually have a snuffles. They have to breathe through the mouth over here. And the discharge which is indicated over here is yellowish greenish discharge over there. So it is the psychotic miasm is predominant, and here the season which is aggravated is autumn and winter over here. And there is sneezing, heavy water discharge, and coughing spell over here with little sputum, because there is stoppage, more thick discharge over here, so it can difficult to discharge for the patient. In the tubercular phase, there is slow recovery, and this lasts longer. In severe form of hay fever, when symptoms are present, is often from the tubercular state, with hiding of psychotic tendencies. Discharge soon become thick yellow with old cheese smell. Here you will going to find that particular smell, that is smells like old cheese, and mucus also runs down to the back, the throat. The cough deep lasts for the long time and worse in the morning, and patient often worse in night, and there is also a fear of it. The next is syphilitic miasm. Usually has thick crust and can fill whole of the nose. thrush is dark greenish yellow. The nasal bone may become breakdown, and nasal septa may be corroded. Smell often completely lost. Post-nasal drip, here you will going to find that post-nasal drip, which you are usually find in the Kali groups, in the natrium carbonate, which is going to worse in the night. And the patient is tired with the dry cough, with the tendency for the pus over here. So what is the homeopathic approach? According to the homeopathy, for the chronic stage, it is usually indicated that constitutional medicine is needed, or in certain cases, anti-miasmatic medicine is needed. It is according to case. But in the acute phase, we need the acute medicines over here. And in certain cases where it is difficult to find the constitutional medicine or sharp indication, in that particular time, we need a therapeutic medicine for the allergic rhinitis. So here the homeopathic therapeutics, which is indicated for the allergic rhinitis. First, which is mostly indicated is Allium cepa, where you will going to find that running nose. And there is lot of discharge over here. The characteristic of discharge is it will going to be burned. There is discharge from the nose is acrid over here. And there is constant frequent sneezing. And the characteristic of sneezing is it is aggravated in the mouth. And there is also affections of the eyes. There is tears from the eyes. There will be ameliorated and in open air, and it is worse in the warm. And there is sensitivity to light. It is associated with the headache. And in indoors, it is worse in indoor. The coryza is going to be worse in indoors, or stoppage of the nose is worse in indoor, and the patient is better in the fresh air. One more indication of the Allium cepa is when you are having the coryza in the autumn, the Allium cepa is indicated. The second indication is it is also indicated in the wet weather or in the rainy weather, coryza in the rainy weather. Then the another medicine is arsal. Here you are having stuffed nose, and there is strong sneezing, and there is burning, which is characteristic, and discharge, it is same as an Allium cepa. It is corrode the upper lips, and it is raw discharge. And from the eyes, it is also biting over there, and the eye is sensitive to that. Here, the open air, aggravation from the open air, damp air, and it is opposite to the Allium cepa. It is better from warmth, and the nose feels raw over here, as the discharge is acrid over there. There is also bleeding from the nose in certain cases, and often there might be worse, or the complaint is worse in the summer weather. Next medicine is Aralia racemosa. Here there is frequent sneezing, there is nasal discharge, copious discharge, irritability, and there is a salty, a sharp taste of the nasal discharge. There is watering from the eyes, from the slightest draft of air, and there is sneezing, and symptom is worse by the sneezing. Nose is going to be blockage, stuffed, and there is modality, that it is worse from even slightest draft of air, lying down in damp or in night time, and condition is also worse in the 11 p.m. in the night. Arsioid is a kind of a syphilitic medicine. It is indicated in hay fever, where there is constant sneezing one after another. And the second characteristic is the discharge, which is very irritating discharge. It will going to corrode the nose, and also in the throat you will going to find that small ulcers in the arsioid. So that is the characteristic. That is red swallow and inflammation, and there is severe burning and irritation when discharge goes on. That is nasal congestion lasts longer, and there is swallowing of tissue. With this, there is eustachian tube is also affected over here, and there is sneezing, irritation, and it is worse in certain climate and season. and there is kind of a bad smell from the nose or from the discharge. Erythrophyllum. Erythrophyllum, you will going to find that hoarseness of voice over here. Here the throat is also affected. So there is sharp irritating nasal discharge inside the nose, and there is irritation in upper lips, which is raw, sore, and have a small streaks of blood from the nose. There is blockage of nose. They have to breathe through the mouth. There is sneezing, which is worse at the night. And the key feature is there is constant picking of the nose until it is sneezed. The patient will going to pick the nose. There is pain, lips, and corners of mouth are cracked, which is the 3-mark symptom of erythrophyllum. And there is hoarseness of voice in speakers. It is worse by wind, exposure to wind from cold draft, and part is feels hot and face may be chapped. It is better by fresh air. Erundo is most neglected medicine, but it is more indicated in the hay fever or allergic rhinitis, where the patient is find that there is constant itching in the root of the nose. There is constant burning in the and mouth and in the eyes. There is much itching in the nose and around the mouth. So patient is itching, having itching and redness in the nose or inflammation due to this itching. There is itching. You will going to find that itching is 3+ in the erundo patient. And there is also running nose. And with this, there is loss of smell. And discharge is watery at first, and it has become irritating afterwards, burning and itching with troubles in the breathing, and the nose is blocked over here. The next is benzoic acid, where there is itching in the nasal septum, pressure at the nose, sneezing with hoarseness and pain, and it is reduces sense of the smell. Occasionally nosebleed and nasal discharge may be smell bad over here. Then dulcamara, as we know that when you are having the hay fever or the problem in the damp weather, the dulcamara is indicated over here, right? So you are having runny nose, watery eyes, and sneezing. Nose may be feel blocked, and it is worse in the damp weather and better in the dryness or warmth, and there is frequent itching. Over here also in the dulcamara, you are having the tendency of urticaria over here. Okay. Then next is cuprum aceticum. Cuprum aceticum found in the reference of inflammation of nose and hay fever-like symptom. Sneezing, running nose, especially triggered by the irritant, and it may be cause swelling inside the nose, cause itching, tickling, feeling in the nose. Then euphrasia, as you know that it is affecting more to the eye symptom. So there is eye affections are more over here, and there is burning in the eyes. Here the discharge of the eye is more accurate, and the nasal discharge is bland over here, and still there is sensitivity of light, and the patient feels better in the fresh air, and it is aggravated indoors. The next medicine is gelsemium. Gelsemium is having the problem from the sun. So here usually you will going to find the running nose, blockage of nose, or rhinitis in the summer weather over here. And you will going to find tremendous weakness over here. Next is Medorinum. Medorinum, as you know, that is a king of psychotic medicine. So you are having yellowish greenish discharge, and there is also a post-nasal drip over here. And there is itching and burning, and they feel blocked as if nostrils are blocked over here. So it is basically affecting the nose, and there is more blockage in the nose. Sorinum. Sorinum, as we know, that is predominantly a psychotic medicine. So it is written in the Materia Medica that the patient is having allergic tendency. Nasal discharge may change from one type to the another, and it is smell bad, and it is irritating to the throat also. There is sneezing worse in the damp weather, and there is generalized weakness, and nasal lining easily flare up. So nasal symptom is easily flare up over here. Natrum muriaticum. As we see that in the most of the allergic reactions, the medicine which is indicated, whether it is urticaria or the allergic rhinitis, the natrum mur is going to work very nicely in many of the cases. So here you will going to find that runny nose with lot of clear watery mucosa, and sometimes it is egg-like white. Strong sneezing, especially in morning. There is loss of smell, itching, watery eyes, and symptoms get worse from the sun, in the sun, and it is better by the fresh air. Next is natrum sulf. In natrum sulf, you are having the tendency that the person's family history is of the asthma. Okay, so here often when you are having lot of water discharge, but here the patient is going to aggravate in the damp weather. There is nasal mucous membrane is thick or sticky. It can be switched between runny and thick, sneezing watery from the eyes, and there is tendency towards the asthma or towards the chest complaint. Then pulsatilla, as we know that it is having that particular yellowish greenish discharge, which is similar to your natrum sulf. Okay, but the in the natrum sulf, there is more affection from the dampness, what you will going to not find in the pulsatilla. And the nature of pulsatilla is and the natrum sulf are the different. Natrum sulf is more angry kind of personality, while in the pulsatilla you will going to find more milder personality over here. So there is symptoms are often changes over here, and he feels better in the open air and worse in the closed stuffy room. And sneezing and blockage of nose come, and with the runny nose, itching in the nose, and symptom may get worse in the evening and indoors. The next is sabadilla. The sabadilla is very nice medicine for the allergic rhinitis. In sabadilla, you will going to find that the patient is having constant continuous sneezing for 15 minutes, 10 minutes. For that particular symptom, you can indicate sabadilla, where like what you will going to have in the VATIA, that the patient is having constant itching in the throat, that there is certain problem in the throat. Same in sabadilla, it is indicated where there is constant continuous sneezing one after another. So it is very strong sneezing attack. Feels like you need to sneeze all the time. Tickling and irritation in the nose. Itching like something tickling in the nose and throat. Lots of thin watery nose discharge, and eyes are often watery and sore. There is sensitivity to smell, to perfume, or to the pollen. And was from the air, was from the air over here. Viathia, Synapus nigricans. Synapus nigricum, there is nose blockage over here, and which is from one nostril to another. So one time one nostril is blocked, another time another nostril are affected. Eyes watery and hot feeling over here. And there is discharge, that is burn and tickle. Nose feel blocked, and often there is burning. That VHI, it is also very good medicine for allergic rhinitis. So here you will going to find itching in the nose, behind the nose, in the throat, in the ear. So the characteristic symptom in the VHI is itching, like what you will going to find sabadilla. You are having the constant continuous sneezing in the sabadilla. Irritation in nose, sneezing, and there is dry irritation in head, nose, stiff, but irritation is strong. Other medicine for this is tuberculinum and histamine. So other medicine which can be indicated for this kind of complaint is tuberculinum histaminum. As we know that histaminum is the form from the synthetic substance, right? As we know that histaminum is increased in that allergic reaction. So histaminum is very good medicine, very less materia medica aspect has been given for the histaminum. But whenever you will going to find that person is not reacting to any kind of medicine, give the histaminum hydrochlorinum in 30 potency. It will going to work very nicely. Immediately, within certain hours, the patient will be stopped sneezing or stop the allergic reaction. It is also indicated as an intercurrent medicine over there. And tuberculinum is indicated whether a patient is having frequent tendency to take a cold, or the patient is not going to react to the constitutional medicine. So in that condition, tuberculinum is indicated. So there is the one case over here which has been described, that that is the male patient, 45 years, and he is basically salesman, and he is affecting from the allergic condition. Okay, so there is nasal blockage, painful dryness, and recurrent tendency for allergies. There is urticaria associated with the allergic reaction. For past 2 years, the patient is having allergic rhinitis or allergy related nose symptom. Before that, also he had an urticaria or hives. He took allopathic medicine, but it not give long lasting relief. What you will going to find in the patient affecting from the allergy, the allopats or the other system will going to prescribe them the cetirizine or antihistaminic substance, and it will going to relieve them for the certain period of time. So the patient is usually tired from this kind of treatment. So he has taken or advised to take an cetirizine over here. He take this medicine when the symptom is severe. So that is the basic LSMC what I had found over here. There is frequent discharge in the nose per year, month, week, 2 to 3 times per week. He is affecting, having running nose, discharge, blockage of the nose, and sneezing, which is 10 to 12 times. And during of attack, it is long last for a day, and it is including sneezing and running nose. What is the cause? Any triggers are that? Mostly, which you call the allergen over here is dust, soap, and fumes. And the season which is aggravate to the patient is the summer weather. Usually you will going to find that the patient is aggravated in the monsoon usually, but here you are having that summer aggravation. There is no any kind of concomitant. So very particular what I found in the totality is, in the mental level, he is very kind person and feels let down because he is having feeling that having fought frequent fight with the wife, and he feels that wife is not going to understand to him. So you will going to find that kind of caring over here, feeling of let down or frequently disappoint from the wife. And there is feeling of grief, and there is worry about the children. There is running nose, what you will going to find that particularly in the summer season, and discharge is watery, and there is face, sweating in the face over here. Associate complaint, what you will going to find over here is hives. Here the urticaria is associated with the nasal complaint, which is present before he is having allergic rhinitis. Present before 4 years. What happens? Twice a month. Hives, itching. Here, what you call yellow dal or lentil, chana dal is aggravate or having the urticaria from that. he is having urticaria after eating the ginger, brinjal, groundnut, and having also urticaria from the dust. So there is association of urticaria with the allergic rhinitis. In the most of the patient, you will going to find that atopic history or allergic history, or you will going to find the history in the parents, strong history in the parents. That is the life space. That he is the younger son of the family, and he needs everything in the right place. And need a thing which should be arranged. If it is not like that, he is becoming angry, and there is clashes with the wife on the family matter. So he feel that she is not understanding him. And one time when he is having the fight, the wife left the house, and later she came back. So he is having felt that anxiety about the children. He is very sensitive. Cannot watch anyone suffer. If any animal is in the pain, he cries, and when children is suffering, he cries. Mind?
Dr. Vani,
Yes.
we have only 5 minutes remaining.
Okay. So he's angry, want thing in the right place. Here you are having grief, and he is very sensitive person, not sympathetic. And there is also a disappointment and anxiety about the children. So with the totality and with the repertorization, here calcarea, phosphorus, natramur, and nux vomica coming in the picture. So after the seeing the sensitivity of the patient, I prescribe natrum muriaticum, and with the natrum muriaticum, he is gradually relieving from the complaint. And in the last follow-up, he is only having phytum for the long time. So that is the thing I had seen, and that is my clinical experiences regarding to the allergic rhinitis. Any questions?
Thank you so much, Doctor, because you explained about the cause, about miasm, all the remedies, and the case presentation. It is wonderful and nicely organized presentation. Wonderful presentation. Thank you so much for your presence and knowledge sharing here. And I would like to welcome the participants. If you have any questions, you can raise your hand and ask question. Dr.
And
Ram,
there are some questions in the chat box.
yeah,
Dr.
there are questions in the chat box. If you can read, please read the question and answer.
Yes, I shall read.
And
Can Sorinum be given to a baby of 6 months old? Baby 6 months old is old with chronic catarrh. It's a question from Bobley.
Oh,
so, Dr. Boblim, you can ask directly. Unmute yourself.
Okay, I think he's talking to someone else. So there is another question from Dr. Bilku Prasad Pandey, sir. What about the posology in allergy?
In allergy, what is the susceptibility? According to susceptibility, you can...
No, posology.
Yeah, but posology, mostly according to my experience, I had found many kind of mental symptom over here. So mostly 200 to 1M potency are usually indicated in that kind of a cases. But
Yes.
if you want to give an histaminum, where you will not going to find anything in the case, only you are having only the allergic symptom, right? So it is better to give histaminum in the 30 potency.
Dr. Ramparveshwar, sir.
thank you, Dr. Nandini. Everyone, namaskar. Dr. Bani, congratulations. Very good. Describe the allergy case and allergy sign and symptom according to miasmatic, role of miasmatic. Miasmatic is a very good role. Sora plus psychosis. and mixed miasm, tuberculosis, diathesis, cold, pollution, damp, weather. According to symptom, treat the patient, not the disease. Symptom and miasmatic role. Very good selection, allergy, rhinitis, individualized treatment, and many lot of medicine, dalkamara, Ilium sipa, arsenic, histamine is a very good remedy, and one remedy, pothos. Pothos, dust allergy. Pothos is a very good remedy, dust allergy. So, Savedilla, homeopathic medicine. So, pothos, dust, a specific allergy, and two remedy is a very good chronic case. In chronic case, only one dose. Bacillinum is a 200 one dose. After 10 days, in Fulinginum is a 200 one dose. Only one dose. And very good result in allergic case. So very, very thanks, Dr. Vani.
Thank you.
Thank you. Ghar Ghar Homeopathic, Ghar Ghar Homeopathic.
Thank you, Dr. Ramparvesha, sir. And Dr. Boblim, now also is sir. Dr.
Dr.
Boblim,
Bobli is a very thinking.
please unmute yourself and you're welcome to say vote of thanks to Dr. Vani, and she was ready to answer for your question. Please.
Dr. Wani, that was a very, very in-depth information that we have from you, and you mentioned very deep right down to the mysium, the sora, and all these things. But I did ask a question whether can sorinium be given to a baby 6 months old? Is suffering from catarrh for 1 month, running nose, and all this. So, what is your opinion?
First, take a case, take the characteristic of the patient. Second, take mother's history. Mother's history during the pregnancy. Okay, whether you will going to find any kind of another medicine indicated for the case. Mother may have a certain kind of dreams, or there might be a certain characteristic of the child over there, right? Whether he is playful, there might be certain kind of desire, there might be a certain kind of perspiration, right? So out of this, if you will going to find this, you can give that particular medicine which is indicated according to the totality of the symptom of the child. And sorinum can be given if it is indicated in the case where you will going to find that the mother's basic miasm, or mother is suffering from previous disease which is soric origin, which is of the soric origin. In that case, you can prescribe the sorinum as an anti-miasmatic medicine to the patient,
Okay.
to the child.
So it's safe to
Right.
give baby sorinum at that age. That's what I want to confirm. And by the way, on behalf of IPH, I would like to say a very big thank you to you for a very informative, successful 2067 uninterrupted webinar of IPH. And once again, thank you very much. Over to you, Dr. Ajini.
Queen
Thank
of
you, thank you,
Penty,
Doctor.
Queen of Penty, soric remedy, sorinum. And King of Penty, soric remedy, sulfur. So sorinum is a very good remedy, allergic.
Sorry,
Thank you all the participants, and thank you everyone for your enthusiasm, interest, and the inspiring talk. And I'm inviting Dr. Danesh has raised the hand.
Yes,
What
this is for an announcement for tomorrow. Tomorrow we will have another doctor from the same college, that is Rajkot Homeopathic Medical College. That is Dr. Vishal Bahela, and doctor will be talking about chest pain, a clinical approach to diagnosis and management. Hope all of you will join us.
Thank you. Thank you, Dr. Danesh. And now I am handing over the session to Dr. Shaila. And thank you, everyone. Thank you, Dr. Vani, once again. And thank you, the Rajkot College team, for sharing your knowledge here. Good night. Bye-bye. See you.